I'm the only one in the UK that performed this surgery. And even worldwide, with the exception of America, where pretty much everybody have a go, is the surgery is limited to few centers that have a large volume. And large volume is important because you want to see, one, the track record of the surgeon, but also the more you do, the better you get at it, the more you're exposed to like various different difficult situation, complication, etc. So you need to see if you want to see a surgeon in any walk of life, but especially something that is very specialized and very niche, you need to make sure that the person you're seeing have a track record that you can validate and that they have enough experience. Like this is not an occasional operation. You don't do this once or twice a year because you need to keep that skills up. So in the UK currently, it's only myself, but there are a few other centers in Europe and beyond that do offer the surgery with large volume, like myself.
Yeah. And the interesting thing with that, you're right. I mean, can you imagine this going wrong and you lose your voice altogether? And that's the worst of all worlds, isn't it?
Yeah, it's you don't that's a myth we see a lot on the internet, that you can lose your voice, as in you wouldn't lose your voice, but you can be left with like very hoarse voice, or worse, like severely restricted projection, or severely strained voice. So these can happen, like these complications, which are surgical complication, and the risk of that diminishes with the surgeon experience. For sure.
I'm kind of conscious we've focused a lot as well on voice feminization so far. But you did say right at the start, to some degree, you can work with voice masculinization. Is that correct?
Yes, I do. Although it's something I do not do as often because the need is not there. So for trans men, voice change when they start testosterone. So within 3 to 6 months after starting testosterone, the voice will drop naturally, and it will drop in 70% of cases down all the way to a physiological male range, and when 30% will drop to that androgynous ambiguous range. So it's pretty much almost 100% change happen with the start of testosterone treatment. That's not the case with estrogen treatment for trans women, unfortunately, because the changes are irreversible with testosterone. So for trans men, it's very unlikely they're going to require surgical intervention. But because once you started testosterone, within 3 to 6 months, the vast majority of voices will drop.